From this video, I will tackle about the meaning of pregnancy and abortion. Those words are sensitive, especially to young adults or teens. In 2022, there were 5.4% or 5,531 of women 15 to 19 years old of age who have ever been pregnant in the country. In the Cordillera Administrative Region, teenage pregnancy was at 6.1% in 2022, an increase of 2.6 percentage points from 3.5% in 2017. What is pregnancy? Pregnancy is the term used to describe the period in which a fetus develops inside a woman's womb or uterus. Pregnancy usually starts about 40 weeks or just over 9 months as measured from the last menstrual period to delivery. The second topic is, what is abortion? An abortion or termination is the medical process of ending a pregnancy, so it does not result in the birth of a baby, depending on how many weeks you have been pregnant. The pregnancy can be ended by taking medication or by having a surgical procedure. Let's talk about first topic, which is pregnancy. Let's have an overview of pregnancy. The period of human pregnancy is 40 weeks from the date at last menstrual period, or 38 weeks from the time of conception on average. The former is taken as the beginning of pregnancy in this article. Types of pregnancy. Pregnancy can be single or multiple. The latter refers to conceiving 2 or more fetuses at the same time or conceiving one zygote, which divides into 2 or more separate zygotes at a very early stage of development and forms 2 fetuses. If the former fraternal twins, triplets, quadruplets, or quintuplets are formed. If the latter identical twins or more multiples are born as they have the same genetic makeup. While identical twins are fairly common, identical multiples of higher order are very rare. Trimesters of pregnancy. Pregnancy is divided into 3 trimesters corresponding to specific stages of fetal growth and development. In the first trimester, covering the first 12 weeks, the fetus is conceived and takes shape from the zygote through the stages of embryonic life. All the fetal organs are formed during this time. The fetus is called an embryo for the first 12 weeks after the LMP, or last menstrual period. In the second trimester, from week 13 to week 28, the organs begin to grow in size and to assume their characteristic shape. The characteristic morning sickness of pregnancy begins to wane towards the beginning or middle of this period. However, some mothers feel back pain, like cramps or constipation during this time. The most exciting part of this trimester is quickening, when the first tiny fetal movements are felt. In the third week, 29 to week 40, the baby begins to grow and develop at a rapid rate. The mother may feel breathless as her uterus with the baby rises to fill a major part of the abdomen, pushing up the diaphragm and reducing the chest cavity. Hemorrhoids, varicose veins, and urinary incontinence may occur. Sleeping becomes uncomfortable. Complications of pregnancy. Miscarriage is the most common during the first trimester of pregnancy. Other first trimester complications include vaginal bleeding, ectopic pregnancy, and excessive nausea and vomiting. If the mother decides to have prenatal testing for genetic defects in the baby, finding out about potential or confirmed fetal defects can cause significant stress for the rest of the pregnancy. In the second trimester, the risk of miscarriage drops dramatically, but preterm labor can still set in. Gestational diabetes mellitus, or high blood sugar levels during pregnancy, typically sets in during this period, as may pregnancy-induced hypertension. Postpartum depression also affects a significant number of women, as does difficulty with breastfeeding. Less commonly, around 1 in 1,000 women develop postpartum psychosis. This is a serious mental illness that is considered a medical emergency. Teens pregnancy. Being a teenager and finding out you're expecting a baby, especially if the pregnancy is unintended and not wanted, can put enormous stress on you and your family. However, there is support available to help you to make the wisest choice for you at this time. Finding out you are pregnant or that you will become a teenager father or mother can bring up many different emotions. You might feel confused and scared, or happy and excited. All these feelings are normal and okay. Your feelings will probably also change while you are thinking about your options. Your parents will have their own feelings and wishes, but it is your life and things usually work out best if parents offer information and support but do not try to force you to follow their wishes. What are my choices? If you are pregnant, options for you to consider includes continue the pregnancy and raise your child with a partner, continue the pregnancy and raise your child on your own, continue the pregnancy followed by adoption, and the pregnancy or cold termination. It is important that you have adequate information about all these pregnancy options before you make a decision. Unfortunately, many teenagers delay seeking advice when they are pregnant, perhaps hoping that is not true. If you choose to continue with the pregnancy, it's important that you get medical attention and do not delay important antenatal care. Issues for teenage parents. Being a parent can make it harder to get an education or find a job. Juggling the responsibilities of being a parent with work, school, and a social life can be tiring. It can also be very difficult to get childcare and almost impossible to get afforded childcare. These difficulties can make it hard to cope financially and can make you feel lonely and apart from your family and friends. On the other hand, as a teenage parent, you can find you have all the energy in the world to keep up with toddlers. You can also be better than older parents at dealing with the new lifestyle of being a parent, such as getting little or no sleep. However, it can be a struggle to face parenthood while still physically developing yourself. For teenagers, you may have issues for your parents. Your parents may have any anxieties that come from concern for you. They may experience shock, disappointment, anxiety, anger, and sometimes a sense of guilt or responsibility. They may feel like they have lost their dreams for you. Some of your options could go against their values. They may feel disappointed if you do not tell them about the pregnancy for a long time. They may be concerned about what friends and other family members think. Major life events do not just disappear, and whatever the decision, there may be doubts and sadness for some time. Overview: Abortion. So let's talk about when an abortion can be carried out. Most abortions in England, Wales, and Scotland are carried out before 24 weeks of pregnancy. They can be carried out after 24 weeks in very limited circumstances. For example, the mother's life is at risk or the child would be born with a severe disability. Most abortion services will ask to perform an ultrasound scan to work out how many weeks pregnant you are. The length of pregnancy is calculated from the first day of your last period. Abortions are safer the earlier they are carried out. Getting advice early on will give you more time to make a decision if you're unsure. Deciding to have an abortion. The decision to have an abortion is yours alone. Some women may be certain they want to have an abortion, while others may find it more difficult to make a decision. All women requesting an abortion can discuss their options with and receive support from a trained pregnancy counselor if they wish. You may also want to speak to your partner, friends, or family, but you do not have to. They do not have a say in your decision. If you don't want to tell anyone, your details will be kept confidential. If you are under 16, your parents do not usually need to be told. The doctor or nurse may encourage you to tell a parent, carer, or other adult you trust, but they will not make you. These are organizations, usually known as crisis pregnancy centers, that offer counseling around pregnancy. They do not refer people for abortion and may not offer balanced or accurate advice. If you go to a place that offers pregnancy counseling and you're not sure if they will refer you for an abortion, ask if they refer people for an abortion. Risks of an abortion. Abortion is a safe procedure. Abortions are safest and happen with less pain and bleeding when carried out as early as possible in pregnancy. Most women will not experience any problems, but there is a small risk of complications such as infection of the womb, some of the pregnancy remaining in the womb, excessive bleeding, damage to the womb, or entrance of the womb. If complications do occur, you may need further treatment, including surgery. Having an abortion will not affect your chances of becoming pregnant again and having normal pregnancies in the future. You may be able to get pregnant immediately after an abortion. You should use contraception if you do not want to get pregnant. I hope that you learned something from these videos. For parents, always guide and keep your children safe. If they experience being a parent at early age, they need your support. We, parents, should be the one to teach them on how to raise their children and how to become a good parent. If you have any suggestions or topics that you would like to hear from this video, just comment down. Thank you very much for listening and support to this video. Like, subscribe, or comment down, and always watch every videos I make. In the future, I may give you a reward or anything that I can do just to keep you or encourage you to watch my video. Thank you very much. Mommy F Diaries again. This is my YouTube channel.